Well, good afternoon. I'm Montgomery County Commissioner Dan Foley, and I join my colleagues on the Montgomery County Commission, Commissioner Debbie Lieberman, Commissioner Judy Dodge, to welcome you to today's event. We want to thank you for joining us to learn about significant changes to the way that we provide services to those in our community who are struggling with opiate and heroin addiction. I want to take the opportunity to acknowledge the presence of Mayor Nan Whaley, who has joined us today, and also Sheriff Phil Plummer, who's joined us as well. Thank you both for being here. We're also joined by our Health Commissioner, Jeff Cooper, and the Executive Director of Montgomery County's Alcohol, Drug Addiction, and Mental Health Services Division, and that's Helen Jones-Kelly. These are the two agencies, ADAMHS and Public Health, that lead our efforts to combat opiate and heroin addiction each and every day here in Montgomery County. Back in April, the County Commissioners held a joint work session with the City of Dayton, with Mayor Whaley, with the City Commissioners, with judges from our Common Pleas Court, to really take a hard look at the services out there related to opiate and heroin addiction. And we found some areas that were strong, but we also clearly found some gaps. Following that work session, we took what we learned that day and before that and after that, and we tasked Public Health and ADAMHS with formulating a strategy of new and expanded services for those people in our community who are struggling with opiate and heroin addiction. And so today, as a result of that work between the city and the county and all of our partners, we're announcing that we are investing $3.5 million in additional treatment beds, immediate access to detox and withdrawal management services, and more help and expanded access in the jail for those people who have mental health issues and addiction issues. You're going to hear more about these efforts shortly, but first, before we explain them in a bit more detail, I'd like to introduce to you Montgomery County Health Commissioner Jeff Cooper, who's going to talk about this opiate epidemic and why this is a critical public health issue. Jeff.
Thank you, Commissioner Foley. Good afternoon, everyone, and welcome to this very important meeting. I'm Health Commissioner Jeff Cooper from Public Health Dayton and Montgomery County. We come to you today as partners, and by that I mean Montgomery County, the ADAMHS Board and their staff, as well as the Montgomery County Board of Health and Public Health staff. And we are working as partners to improve the overall health of our community. And specifically for today, that means giving you more information on how we are going to expand treatment and recovery services in this community for individuals who are suffering with an opiate addiction. I put a lot of information together on data, and then I decided at the last minute that we all know the data. Okay, we hear it every day. We see it in the newspaper. We hear it and we see it on TV. We all understand that an opiate epidemic is gripping our country, state, and our local community. It's a public health and a public safety crisis. It touches every single community, and it touches all races. Okay? And as a result of that, unfortunately, unintentional drug overdose deaths are reaching record numbers. If you just consider the data a little bit for Montgomery County, the number of unintentional drug overdose deaths associated with this epidemic in any given year exceeds the number of motor vehicle traffic fatalities. Our county has the second highest drug overdose death rate in the state, unintentional drug overdose death rate in the state. From 2009 through 2015, over 1,000 individuals in our county have died of an unintentional drug overdose. And as we're looking at some preliminary data for 2016, in the first quarter of 2016, we're seeing an increase in those numbers. And that's consistent with other communities around the state of Ohio, especially the urban cores. So this epidemic, and it's really important to stress that it's not just illegal drugs and that it includes prescription drugs as well. This epidemic underscores the importance of having a unified strategy for improvement. And there are two foundational documents that are going to serve as that overall framework and unified strategy. Number one, the Montgomery County Strategic Plan for Health Improvement, as well as then Public Health Dayton and Montgomery Counties Community Health Improvement Plan. Those are the two foundational documents that we need to use to guide us in terms of health improvement in this community. Because I think we all understand that despite the significant resources that have been invested over time regarding treatment and recovery, this epidemic continues to take a devastating toll on the health and safety of our population. So one fact is very clear. Based on everything else out there, one fact is really clear. Our community has shared ownership of this problem. It is not just the health department or the ADAMHS board, it's all of our partners have shared ownership of that. And I'm glad to see many of you in the room today. So it's the ADAMHS system, the public health system, our public safety system, both law enforcement as well as fire and EMS, the medical community, the faith community, our educators, treatment and prevention and recovery providers, as well, we're not going to leave anyone else, as well as the media. You all play a key role in improving the health of our population and making sure we can show measurable improvement regarding this opiate epidemic. So by working together and expanding what we're calling our continuum of care, we can really make an improvement in our community. We can reach more opiate addicted drug users, and we can link them with essential treatment and recovery services in our community. Because at the end of the day, it's about achieving our vision in our community health improvement plan. And that vision is that Montgomery County is a healthy, safe, and thriving community. So let's make sure we achieve that vision. And with that, I would like to introduce Helen Jones-Kelly, the Executive Director of ADAMHS, to guide us through this expansion of our continuum of care regarding this opiate addiction. So Helen.
Thanks, Jeff, and thanks to all of you for being out here today with us. We are smiling. It's not that we don't understand that the heroin epidemic is not a serious problem. We're not smiling because of the epidemic, certainly. We have, in this county, always been in the top tier of innovation and collaboration, and that's always been something for us to smile about. The epidemic has kind of hit us in the gut, and while we don't smile about the epidemic itself, we smile about being able to come today and talk about, again, a level of collaboration and innovation that will make a difference in our community. Some time ago, we noted that we were, with combined dollars, putting some $10 million towards the issues around addiction within Montgomery County. And so being able to share with you today that we are going to be able to put an additional $3.5 million of levy funds towards this epidemic means so much. And I think that's cause for smile, because indeed it undergirds what happens in our community when we all come together, as Jeff said, and work towards a common cause as a common people. So what we're going to be doing in terms of this expansion, and Jeff mentioned it in terms of it being a continuum of care expansion, with the operative word here being care. This is about compassion. This is about how we work to serve the citizens of our community who are grappling with a brain illness called addiction. We have a number of initiatives that we are going to expand, in some cases launch as a new initiative in order to make a difference. I want to share some of those with you right now. For example, we've talked a long time about ambulatory detox. To give it its most correct term, we're going to be doing a new ambulatory withdrawal management service in a partnership with Samaritan Behavioral Health. This launched actually on August 1st, and it's a 10-day ambulatory withdrawal management program which serves up to 20 people a week. That's 1,000 people 1,040, if I do my math correctly, people annually, and it's going to provide a level of medication protocols that will allow people to be able to transition successfully to other treatment programs. Over the course of time, it allows us to go from serving 720 people in the community to over 1,000. That's huge. That's huge. It begins to address a huge need. Does it cover everyone? We'll be honest, not yet. But certainly it makes a great effort towards addressing the need as it currently exists, and then we will be able to gauge what we need to do to continue to ramp that up to serve more people as the need dictates. We're also offering a new 24/7 crisis care program. This is an expansion with crisis care which will allow us to serve people who are rescued by Narcan from an opiate overdose. This will give them immediate access to treatment if they so choose. We'll also be able to offer, with that part of this expansion, secure transportation from a hospital once that person's been medically cleared to crisis care, where they can be screened and then be connected to services immediately as needed. We're also going to be able to double the number of residential withdrawal management beds in a partnership with Nova Behavioral Health Care. Annually, this access has been allowing us to serve people with 4 beds. We're doubling the number of beds, which allows us access from 720 people in a 7-day residential program. In time, will allow us to serve over 1,000 people, because we're going to increase those beds again by the end of this year. That's a short period of time which allows people to withdraw safely from the drug and then get connected to services immediately. A new program is being developed with one of our community hospitals, where we'll be able to provide recovery housing for between 16 to 32 parenting and pregnant. And we're really excited about that. They will be able to remain in that program as long as necessary and give us the opportunity to help them and their young people get onto a recovery track for success with their opiate recovery program. Commissioner Foley mentioned that we have a new expansion for our jail, and that's another exciting piece, because many of you know that when people go into an incarceration, they lose their Medicaid eligibility. We have opened our portals so that those who are already connected to treatment through the ADAMHS system will be allowed to continue their treatment with their ADAMHS provider while they are incarcerated, and ADAMHS will cover the costs for that treatment program during the course of their incarceration and until their Medicaid eligibility picks back up, so that they don't have to lose continuity of care while they're in an incarcerated process. And finally, we're doing a major innovative program that we believe is going to really demonstrate the level of care and compassion that we have for working with people where they are. We're developing a wraparound service program that will make a 1-year commitment to people who are in need of services. This will be the very high-end, high-risk persons who are in need of treatment services and who have had serious problems remaining in a program. We're going to work with them in their own homes, in their own environments, and wrap around services not just for them, but for their environment. Who are the family members who are impacted by their addiction? How do we help them get connected to housing, employment, and a level of sustainability? And that takes more than a 28-day or a 45-day program. So we're going to be working with them in partnership with public health to make sure that we have a continuity of care and aftercare for those high-end persons that we've been able to identify through some of our frequent or more, the people who tend to recidivate within the system. And we're going to be able to offer them intensive services that we know will make a difference. This is the kind of programming that is going to change the way in which we provide services overall in our community as we move more to wraparound services, in-home services, and getting away from traditional modalities and getting into creative programs that really serve people within the need that they demonstrate for our system. Again, we're talking about $3.5 million of additional investments in this community through our Human Services Levy. Again, a reason to smile, because we have something in this community which allows us to collaborate, to serve, and to offer more than other communities can typically, because we are willing to come together and have difficult conversations about how we serve people, not how we serve systems. So this is an exciting day for us. It's a serious topic, but it's something for us to be proud of as citizens of this community as we talk about ways that we're going to be more responsive to the needs of those who are suffering with an opiate addiction. Commissioner Foley?
All right, so you've heard Jeff give some context about the issue, and then Helen certainly kind of give a detailed explanation of each of the new programs. And now I think we have an opportunity to field some questions if Helen and Jeff want to come on up. No? Good. Chris, anything?
Yeah.
Okay.
Can you talk about why this is an investment? What's the goal down the line? Will it eventually save money? Is that the reason?
Well, I want to touch just on the last program, well, actually two of them that Helen talked about. I was the former co-chair of the Montgomery County Alcohol and Drug Task Force with Jim Pankos from Premier Health. And a couple of these programs that Helen articulated have been talked about and needed for a while. One of them, and the sheriff's here, one of them is about trying to get more help in the jail who have mental health issues. I mean, this is a problem all around the country. So if you can provide people in the jail help that we don't have the capacity to do on a normal level, that person might live a better life, and certainly that could save money because we might be able to find a way to get them help quicker. And then the last one Helen talked about was the wraparound services for the high users of crisis public services. There's a fair number of people in this community who spend many nights at the county jail. They spend they get admitted to the emergency room on a pretty significant basis, and they interact with our public agencies that offer them help. And those individuals, when you talk about saving money through this program, if we can really figure out ways to address their problem, help them live a better life, and yes, in fact, spend fewer dollars as a community in the process, I think you can save money. You can help people live better lives. So I don't know, Helen and Jeff, do you want to add on to this?
I'll add one more thing, only because our board had a conversation about that particular program, and we likened it, and we don't want to oversimplify this, but we likened it to the way in which we raise our children. We nurture them. We help them develop the ability to make good choices in life. And a lot of the people who tend to be in the high-end user column, if I may say it that way, may not have had that level of nurturing in terms of decision-making with their own brain development. This is a brain illness, so this will give us a chance to go back with a compassionate program and offer them some guidance beyond just treatment. This wraps the services around them in a way that lets them begin to make good, healthy choices, not just around their addiction, but around employment and sustainability. So we're really excited about that piece. And it's going to cost more initially. It costs more to do that kind of program, but it yields such great benefits on the other end in allowing people to become truly self-sufficient.
Well, if nothing else, thanks everybody for allowing us a chance to share what we're doing today. And then at 1:30, I think Helen and Jeff are going to repeat this for the commission, just so we can share this with a little bit wider audience as well. Thank you. Thank you.